Okay, this lecture is about iron and its association with diabetes. So first of all, the question is what damages the pancreas beta cells. So the pancreas beta cells are the ones that produce insulin. When a person loses the pancreas beta cells, they lose the beta cell production of insulin and they become insulin dependent diabetic. Earlier than that, they have prediabetes and diabetes that's not insulin dependent yet, due to a lack of insulin sensitivities because of insulin resistance. So the first thing that it does is a high-fat diet. And we talked about this before. I've given like about 6 lectures on diabetes. So I'm only going to briefly just stay here. We've shown that high-fat diet is the number one, by far the most important cause of diabetes. You can see the other lectures if you're interested in it, but that's an important thing to know. So the first thing to do if you want to reduce your risk of type 2 diabetes is reduce your dietary fat intake. And Michael Brownlee wrote the best paper on that subject. The Gerald Shulman papers are great as well. Omega-6 oils contributing to beta cell loss. That is especially the work of Dr. Yamashima, Tetsumori Yamashima, the Japanese neuroscientist. And omega-6 oils lead to lipid peroxidation. That leads to generation of the toxic aldehyde hydroxynonenal, and that leads to damage to the beta cells. Okay, the third cause of insulin resistance contributing to insulin resistance and diabetes is excessive stress. Stress elevates the hormones, cortisol and catecholamines. Those both increase blood glucose level, cause decreased insulin sensitivity, and you can have a lot of things building up, what are called stress equivalents, like caffeine raises the same hormones, sleep deprivation raises the same hormones. Some people are taking corticosteroid medications. Okay, so these are contributing to insulin resistance. Also, it's a long story, and this is not the major contributing cause, but excessive dietary sodium has a mild contribution to insulin resistance, and that typically is coupled with a relative lack of dietary potassium and magnesium, because potassium and magnesium come primarily from plants. Sodium comes primarily from processed food. Okay, well, that disrupts the plasma membrane ionic gradients, and that leads to a worsening of insulin resistance. And then the big one for our purposes here today is excessive dietary iron. And excessive dietary iron is a contributor to diabetes because it's toxic to the pancreas beta cells. And you can also see how this works. You know, just one meal of, let's say, eating fried red meat, okay? You're going to have high-fat diet, lots of saturated fat from the meat. You're going to have, from the frying, omega-6 oils, from the sodium that's probably put on it to flavor it, and then from the excess dietary iron associated with multiple risk factors for worsening pancreatic function. Okay, hereditary hemochromatosis is a disease where they have a mutation in their DNA leading to increased iron absorption, and they get diabetes, and they also get skin pigmentation, so it's called bronze diabetes. But the point I'm making is when a person's absorbing too much iron, they get diabetes, all right? And so when we eat too much iron that's absorbed in large amounts, like heme iron from meat, we're increasing our risk of earlier onset diabetes. Why does it cause the injury? You know, it might be oxidative stress. They're shown to get diabetes also in animals when you feed them excessive amounts of iron. In humans as well, typically diabetics are going to have high ferritin levels, indicators of excessive body iron. It might be due to excessive oxidative stress as a mechanism of pancreatic injury. It might just be synergistic with other causes. Let's see, and then iron's associated with all these things that are just same as associations with meat. And you know, how much is due to the saturated fat, how much is due to the iron, we don't know, but we do know they both contribute. They both have a separate independent contribution as well as potential synergistic effects. So the bottom line is if you have diabetes or worried about diabetes, you want to check your serum ferritin, and you don't want to be iron overloaded. That's it.